Outside her modest house, Stella Atieno sets up shop for the day. From this place, she sells snacks, sometimes vegetables. This is how she earns her daily bread. Every so often, and with increasing and worrying frequency, she has to leave her business untended and attend to a more pressing, sometimes life-threatening duty, that of being a traditional birth attendant. On this day, she has 3 clients who are seeking her services. All ladies are at different stages of their pregnancies. She has been a traditional birth attendant for close to 30 years, but the government's emphasis on hospital deliveries forced her out of this business. That is until the industrial action by healthcare workers forced the clients back to her doorstep.
Nikienda kwa hizi hospitali za serikali kutafuta matibabu, unapata hakuna madaktari, wamegoma. Wanakuambia ni unaambiwa uende utafute usaidizi kwa hizi private hospitals. Na ukiangalia kwenda private ni mpaka uwe na pesa, na sasa zingine unakuta sisi wa mama mtu hauna pesa.
Kutegemea wakati wa mgomo kama sasa hii wanakuja wanategemea mimi, wanakuja mimi na mkanda, kifika wakati yake wanakuja wanajifungua wanaenda kwao.
Mtoto She isn't the only one who has had to go back to a practice that the government once outlawed. Sylvia Osondo has also been forced to come out of retirement to help women in distress, quite literally. Her return to this work was dramatic, to say the least. It was Sylvia who delivered Lillian's second-born child by the roadside. Lillian had sought services at the government-owned hospitals but was turned away several times because there wasn't anyone to serve her. The healthcare workers then were in the throes of the doctors' strike.
Nilienda hospitali. Kwenda hospitali clinic hapo hasa niko mjamzito. Nikaambiwa daktari hawafanyi wako kwa mgomo. Wakaniambia uko na TV, nikaambia, wakasema nenda ukae kwa TV ile siku utasikia kuna mgomo. Mgomo umeisha ndio utafanya nini? Ndio utarudi. Mimi pia nilirudi hivyo nikakaa.
When her due date arrived, she was in no position to afford the services of the private clinic within her neighborhood.
Nikasikia nduru. Kasema, ai jamani nisaidieni. Sasa mama mwingine akaniambia, mama Priska, jamani njoo msaidie huyu mama kama anataka kujifungua. Ikabidi nitoke mbio. Nikifika pale napata mtoto ndio hiyo kichwa, na hapo mrandani ambapo iko karibu na ni barabara. Mtoto anaweza kuanguka chini, mtoto afe ama mtoto aumie. Ilibidi nimsaidie.
It is a fate that Damaris Nekesa hopes to evade. She is 6 months pregnant and in need of prenatal services. She hasn't been able to access them, especially with the nurses' strike still biting.
Ndio nimeruzi hope sababu nimeshajua ya kwamba sitahudumiwa tena. Nikaambiwa hakuna nurse. Kama we ni mjamzito yoyote, una kitabu, una nini, haushikwi yani hauguswi. Naambiwa hakuna nasi mpaka siku yenye watarudi kazini. Na sasa hatujui watarudi lini. Labda mwaka ujao. Haya niambie, safari hii yetu tutaenda mpaka wapi?
She may persist in her quest to get the crucial prenatal care, but others are and have already thrown in the towel and reverted to seeking these services from TBS, whose charges they can afford, but whose quality of healthcare isn't always up to standard.
The people who know there's a strike, they look for other ways. And unfortunately, now deliveries are being done by TBS, traditional birth attendants. I mean, if you're sick, you'll go to Mitishamba now, if the doctors or nurses are not there to help you. So I think it's not like before. People know, and we see immediately when there's strikes, the numbers that come to the hospital just drastically drop.
The effects of these strikes are now going beyond just the treatment of diseases. They are affecting the health-seeking behaviors of people, especially those who live in low-income areas where health insurance is unheard of and expensive.
We had reached a level whereby the health-seeking behaviors had really improved. But because the lack of these services, because of our human resource strikes, is now causing the community to even have mistrust, to develop apathy to going to the health center because they don't foresee that those health services can be, accessed at our facility.
The country has in the last 1 year experienced 2 national strikes by health workers. The doctors' strike that started in November of 2016 and lasted over 3 months, and the nurses' strike that ran concurrently with the doctors' strike but was suspended and has since been reactivated. Both sets of health workers demanding better working terms. But it is the nurses' strikes that experts say is hurting the health-seeking patterns most.
One health worker that you would see at any given time in the hospital, because nurses work in shifts. So you might come to a hospital at night and you might not see a doctor, but you will never miss to find a nurse.
While both the nurses and the government stand by their hardline positions, mothers like Lillian will continue to miss out on the essential services for their babies, while those mothers to be like Damaris face an uncertain delivery that more often than not will be done in unsanitary conditions, putting into jeopardy the progress made in reducing maternal mortality in the county and the country. Brenda Wanga, NTV in Mombasa.